Hi, have you ever walked into a pharmacy, stood on the over the counter section, and felt totally confused about which medicine to pick? Whether it's a headache, heartburn, or allergies, there are so many options available. It can be overwhelming at the time. Hi, my name is May, a pharmacist. Today I'm going to break down the most common OTC medications and share insider tips to help you choose the right ones every time you walk in the pharmacy. Let's start with the painkillers. The three main type you will see are acetaminophen, ibuprofen, and naproxen. Acetaminophen, also known by the brand name Tylenol, is great for fever, general pain, and it's gentler on the stomach other than the other painkillers available. So it's often the best choice if you have ulcers, acid reflux, or any other gut issues that you have. It's also safe to use during pregnancy when taken as directed by the physician. However, one big caution to avoid using it with alcohol because both are processed by the liver, so too much can cause serious liver damage. Be cautious about it. Next up, we have ibuprofen, sold as Advil or Motrin, the ideal one for inflammation. If you have got the joint pain, menstrual cramps, or sprained ankles, ibuprofen works well. It doesn't need to be taken with food because it can irritate the stomach. If you have ulcers or kidney problems or heart issues, ibuprofen might not be safe, so always double check with your healthcare provider for that. Then there is naproxen, which you will find as a leaf. It works similarly to ibuprofen, but it lasts longer, usually up to 12 hours. That makes it really good choice for chronic painkillers like arthritis or migraines. So if you need long-lasting relief without taking multiple doses, naproxen is your go-to. Here is quick summary for painkillers. If you want fast relief without upsetting your stomach, go for acetaminophen. If there is inflammation involved, ibuprofen or naproxen are usually better. And never mix ibuprofen and naproxen together. That increase your risk of stomach bleeding. Now let's talk about something just as common: antacids and acid reducers. Heartburn, indigestions, acid reflux. These are all too familiar, especially after a spicy meal or late night snacks. First, there is calcium carbonate, which you will see in products like TUMS or Rolaids. These are chewable tablets that work quickly, usually within 5 minutes. They are perfect for occasional heartburns, but don't overuse them. Taking too much can lead to rebound acidity, constipation, or even kidney stone over the time. Next we have the H2 blockers like famotidine. You might know it as Pepcid. These take about 30 to 60 minutes to kick in, but they last long up to 12 hours. They are great if you know you are going to eat something that triggers your reflux, like before a big dinner. Then we have strongest ODC option, proton pump inhibitors or PPIs, such as omeprazole and lansoprazole. You might know them by names Prilosec and Prevacid. These don't provide immediate relief. They take 1 to 4 days to start working, but they excellent for the people who have frequent severe acid reflux. These don't provide immediate relief. They take 1 to 4 days to start working, but they are excellent for people who have frequent or severe acid reflux. Just a note, don't stay on PPIs for longer than 14 days unless your doctor tells you to do so. Long term use can increase your risk for vitamin B12 deficiency, bone fractures, and certain infections. So here is the takeaway. TUMS is a great choice for quick relief. Pepcid is great for mealtime prevention. Prilosec is the best for daily, long-term acid control. but use with caution. Now let's move to allergy medications, which are especially confusing with all the different names and combinations. First is diphenhydramine, also known as Benadryl. This is one of the oldest and strongest antihistamines, and it works really very well for allergic reactions like itching and even helping you sleep. But it causes drowsiness, a lot of it. So it's not great for daytime use, especially if you are driving or working. Avoid using that. If you are looking for something non-drowsy, there are many. There are mainly three options: loratadine, fexofenadine, and cetirizine, also known as Claritin, Allegra, Zyrtec. Loratadine or Claritin is the least sedating. It's a great choice if you need to stay alert. Fexofenadine or Allegra is also known as non-drowsy and may be better tolerated for some people with sensitive symptoms. Fexofenadine or Allegra is also non-drowsy and may be better tolerated for some people with sensitive systems. Cetirizine or Zyrtec is the longest of the three, and while it's labeled as non-drowsy, some people do feel sleepy about after taking it. It's often the best choice for post-nasal drip or more intense allergy symptoms. In addition to oral medications, nasal sprays like flucortisone or budesonide, known as Flonase and Rhinocort, are excellent for nasal congestion, sneezing, sinus pressure. These sprays take a few days to show full results, but they are incredible, effective when used consistently. So, to simplify, Benadryl is strong but causes sleepiness. Use it at night or for emergency purposes. Claritin and Allegra are best for daytime, everyday use. Zyrtec is bit stronger and may help more with chronic symptoms. And nasal sprays, of course, are the best add on if congestion is your main issue. So, there you have it, a pharmacist guide to navigate through the OTC aisle like a pro. Remember, even though these medications are available without prescription, they still have risks and interactions. Always read the label, follow the directions, and when in doubt, ask your pharmacist. We are here to help. If you find this video helpful, be sure to like this video and subscribe to our channel, Pharmacist Guide, for pharmacist guided health tips. Thanks for watching. See you next time. Bye bye.